Your website need a voice, or maybe you need to put a little pizzazz in your podcast? I'm Dave Holly from Dipsy Doodle Productions. I've been doing radio and television voiceover work more than 35 years. Put my experience to use for your audio needs. Broadcast, website, podcast, voicemail, and hold messages. Copywriting also available. For more information, go online, dazzleshows.com/Dipsy, D-I-P-S-Y. The name might be a little dipsy, but the quality's big and the rates are reasonable. You're listening to the Tactical Pain Podcast with Jeni Mc. Real people, real pain, discussing real strategies for living a better life.
Welcome back to Tactical Pain Podcast. Today, I'm going to be sitting down and talking with a real live medical professional about pharmacy. A lot of times when we talk about pain management and healthcare, we think about doctors and nurses and surgeons and PAs, but in actuality, in our day-to-day life, especially if you're living with any chronic illness, you are probably going to see your neighborhood pharmacist far more often than you're going to see your physician. And your neighborhood pharmacist is going to have a lot of advice and options and opportunities for you to talk with them. And it's no appointment needed and no big preamble of here's why I'm here and whatnot. And I think a lot of the general public, and particularly in the chronic pain realm, we're not taking advantage of that. So we're going to talk today about how to take advantage of your pharmacist.
Yes.
And very excited to hear that is Dr. Tom Wullstein.
Yes.
Hi, Tom. How are you?
Great. How are you doing?
Good. So, you are pharmacist in Brandon, South Dakota, own your own pharmacy.
I do.
How long have you been in practice?
I have owned my pharmacy for 7 years, but before that I worked at a much larger, kind of a local chain around in the area, and I think I had, 7 more experience or so back then, so I've been doing it for a while.
And you are not just a pharmacist, you are a dad, business owner, member of the community. You're pretty active in a lot of things in your community.
Yes, yep. I try to be a good steward of the community, I guess, and try to participate as much as I can. And I have two young girls, my daughters, and my wife also is an active part of the community. So,
coming from, like you said, you worked for a larger kind of regional chain in a larger city, and then coming, I would say in a way you had a coming home. You opened a pharmacy in the town that you live in and in a smaller demographic. And what would you say is your kind of personal philosophy about how you deal? Are they customers or are they patients?
Oh, I don't know what the actual term I use. I know, like, when I did my little 5-week rotation in Target, they say guest there, but you know, I don't know. I say patient or customer either way.
And I always say if I'm a guest, when I get there, there better be cake and appetizers. So I have high expectations as a guest. Mm-hmm. I guess I like to personally consider myself a patient of anybody that is dealing with anything with my healthcare or my medicine. And I have my own perspective about how pharmacy interplays with that. And I think it's overlooked the connection you can make with your pharmacist. And for any chronic health condition, what's something that you think is, I guess I wouldn't necessarily describe it as a service our pharmacists offer or a pharmacist offers, but in layman's terms, that might be the best way to describe it. What are some of the services that patients are overlooking when they're dealing with a chronic illness and when they need to have a management plan?
Sure. Yeah, especially if you have a chronic illness or especially pain or anything else. A lot of people, I think a good thing to do would be to ask a pharmacist, like, what if you were in my scenario, what would you take? or if you were going to, like, that's the easiest way for me to answer people's questions when they're saying, oh, this drug has this side effect. I read on the internet that this is the worst thing ever. And I just honestly tell them, if it was me, I would take it. If this was my wife, I would feel fine taking this. If this was my mom, yes or no, would I let them take it? And be honest with them, because there's lots of side effects. Every drug has side effects and things, but to get the actual pharmacist's opinion on what they personally think, rather than just maybe I know that this one has metabolizes this way, so you probably should prefer this over this. Just say, if you were me, would you want to take this or would you want to take something else? Because they also are thinking about prices and how the insurances work and things like that. So you'll get the answer of a medicine that's probably going to be affordable, but then also something that's going to work as well.
And with hopefully the least amount of side effects.
Exactly, yeah.
With chronic pain specifically, obviously I picked you because I know that at your pharmacy you've worked with some specific chronic pain patients and kind of gone the extra mile for them with compounding and finding some unique resolutions for them and things like that. How do you think a patient can approach their pharmacist and make themselves stand out from the crowd? How do I, if I come in and I'm a new patient in your pharmacy, how do I make you understand I'm not garden variety drug seeker?
That is hard, because I had a person kind of do that specific thing, come in and they said, I promise I'm not a problem person, but then they kind of turned out to be a problem person. So
it's not me. He's not talking about me.
No.
I would never promise to not be a problem.
Yep. But yeah, no, just, the only thing I can say is go with the smaller pharmacies, because when you're at a big pharmacy, filling 400 or 500 prescriptions a day, it's unfortunate, but our profession has become somewhat of a sweatshop. Get those prescriptions out as fast as possible, and there's not time to actually make that human connection, which is one of the reasons I want to open my own pharmacy, so I can have time to sit down. Whenever I'm talking to students that are going to graduate, I say, how many prescriptions could you fill a day with being comfortable and also being able to practice pharmacy the right way? How many prescriptions could you fill a day and still be able to sit down and talk to people and show them how to use a blood glucose meter or talk to them about drug interactions? How many could you fill a day and do that? And the answer is usually maybe 100 to 150 a day. Well, your average big store fills 500, 600 plus a day. So unless there's 4 pharmacists on staff, which there is not, they're being very overworked. So if at all possible, I would just find a good pharmacy, a smaller one, usually ones that are independently owned, just because it's always, anytime with any business, if you can work directly with the owner, it seems like you get the best results. And
because for you, when you think about it, if you provide good service and accurate service, the whole business rides on you today.
Yep.
Like if you're an asshat and people don't come back,
yep.
it's all on you, the bread and butter.
Mm-hmm.
And I think, and that's not to say that the large chain pharmacies or the pharmacies that are doing that many a day, if you're getting your traditional run of the mill, there are some people, they don't need a medication every single month, or they don't need. They're not like me. They don't need as much hand-holding through a condition. And so they serve their purpose in the community. But yeah, if you feel like you're at the point where you need to make your pharmacist part of your pain management team, then you need to find a pharmacy that has the resources for that. And the resource is time.
Mm-hmm. Exactly, yeah.
And maybe a little bit the resource is latitude, allowing you to have that face-to-face interpersonal connection.
Exactly.
What do you think is one of the biggest hurdles that patients are facing right now? I know there's obviously a lot of talk about opioids and things like that. What do you think the patients are actually missing because we're distracted by what's in our Facebook feed and in our 24-hour news cycle? Do you think that it's what's happening with insurance or drug availability? Do you think it's because we're getting pigeonholed into doctors are just prescribing the same things?
Well, there's a lot of things, especially with pain management, that is going on. The big thing right now is, unfortunately, especially for pain sufferers, is everyone's terrified to do too much. It's like, if you're a doctor, you want to prescribe enough to help someone, but you do not want to overdo it, because if you overdo it too much, then they might come after you. Or the same thing.
And who's the they that might come after you?
Well, at least with pharmacy, you're like, the one thing you do not want would be like a DEA audit, which is not that there would be anything wrong. It's just, it's a lot of time. They're there for days looking for things. So if you say, specialized in helping people with pain, and you were filling a whole bunch of pain meds for people,
you're making yourself a target.
Yes, if 50% of your prescriptions are for pain things, you're going to get an audit. So you you have to be kind of careful with that sort of thing. But then I just kind of read saw an article about how sometimes they'll have, doctors will say, yeah, I know this is 5 days early or 10 days early, but go ahead and fill it anyway, and then the pharmacist would fill it. Well, the pharmacist they determined is liable, regardless of what the doctor says. Even if they say, go ahead and fill it, it's the pharmacist, at least partially the pharmacist's fault for filling it. So theoretically, if it's 5 days early and you don't feel comfortable filling it, you shouldn't. And
you're not in a position where you're saying no to the patient because you don't trust or believe the patient, but we're bound by safety. It's not just being bound by the law. It's what I think a lot of patients don't realize is, if they are needing to fill it early because they're out, if they've been taking more than is prescribed or taking more than is the recommended daily dosage, then they need to have a discussion not about why they need to convince their pharmacist to fill it early, but why didn't it last?
Yeah.
And how do you think that, without sounding like a drug seeker, how can someone approach their pharmacist? At what point should somebody be approaching their pharmacist and saying, look, this is what I'm prescribed. This is the honest, truthful way I'm using it. And it's not getting me to where I need to get. I think people fear that by being honest about how they're taking things, you're going to call the cops on them, or you're going to yank their availability to their access to their meds. What's a good way to approach your pharmacist and say, I'm going to tell you straight up front, I'm taking this different than prescribed?
Yep. I mean, the main thing I would say is just to be honest, because I had a person, I have the chronic pain in my family, so I'm very sensitive to that issue, and I realize the whole, the worst thing that you want is to run out of drugs on the weekend or run out of your pain meds. So I understand trying to get it filled 5 days early or a few days early every month, just so you have a little bit of a stockpile, just in case the worst comes to worst. You have a little bit extra there. But I had some person who wanted me to fill something 2 weeks early, and I very bluntly said, you need to tell me the 100% truth right now. How many pills do you have left? And they flat out lied to me, so then I had to do the pharmacist thing and say, okay, well, I'm going to tell every doctor, or now I have to show every doctor what you've gotten filled and when, and because now it's not just you're trying to get something early, it's you're trying to do something illegal, so you're lying about it.
It's part of your role in the community. Going back to that, you try to be a good steward for your whole community in determining, are you a patient that is in personal trouble, like the med isn't doing what it needs to do, or are you a patient that is dealing this back into my community in an unsafe way?
Yeah, or that
happens less in our region, my hope anyway. But there are places where that's the thing. People are trying to get more and more because they are putting it back into the community in a different way.
Yep, exactly. Or just, do you need different type of help? Do you?
Right.
And that's what I told this person is, I'm going to let everyone know this, and we need to try to find you help. So you can come back with a game plan on Monday. If you want to call me and tell me what your game plan is for getting help. And so she still comes to me, and we have her on a weekly cycle now through the doctor, and she's on a pain contract and things. But yeah, that's one of the biggest things that changed for me. Having a chronic pain person in my life is before it was always, pretty much anybody who needed.
Anybody who was on tramadol for more than just a few days after their dentist appointment.
Yep, they're obviously addicted, and now they're just trying to screw over the system. Where now I understand people how important their pain meds can be to just function on a day-to-day activities. So if people are looking to get something a few days early, I'll maybe allow it to one time, but I keep track of the long period of time. And
and I think one of the services that people don't realize that they can ask for, and that comes from knowing their pharmacist, is, like you said, you don't have to wait until you're in trouble to get on a cycle fill. Mm-hmm. You can go to your pharmacist and say, can we set up a calendar, and this is my day where I'm going to come in and get things, and we're gonna keep track of the days, and then you're going to know I have my buffer at home. Because I think a lot of us, in any chronic condition, whether it's high blood pressure or diabetes or cholesterol, any chronic condition, everybody likes to keep their 7-day backup planner for emergencies. And there's nothing wrong with that, even if your condition is pain. But I think that's another thing that's missed with pharmacy is people shouldn't be offended if they can only get a 30-day supply. They should want to see their pharmacist every 30 days.
Mm-hmm. Yeah, that's one of the kind of a side note of how pharmacy business works. One of the things that we get is some fees from insurance company based on how much we do 90-day prescriptions. And the insurance companies want us to do 90-day prescriptions because, hey, that increases a patient's compliance. And I'm like, that doesn't make any sense. Just because you give somebody 90 pills does not mean they're taking it once daily. I'm like, if that's true, just give them 365 pills at once, and hey, 100% compliance for the year guaranteed.
Right.
I'm the opposite. It should be 30-day fills, and that way, if the person doesn't come in every 30 days, if they're coming in 35 days, you can say, hey, you see that you're a few days late. Did you just miss a couple, or is there a problem, or what's going on? You can have more interaction with people. The more interaction, at least at my pharmacy, I try to ask every time, hey, how are things going, and is it, are you having any problems? Are these still working for you? And I've caught a few things, but just by that simple little interaction.
And I think that in different conversations with pain patients, we talk about the isolation that we start to develop. Our family does not want to hear the same story. Our friends do not understand the story. And they definitely don't want to talk about the side effects of constipation and vomiting and things like that with me. They don't. But you get paid to do that.
Yeah.
You've signed up for that job.
Sure.
So that isolation factor, in a way, I can't go see my doctor every 30 days. But I could go in monthly and see my pharmacist and touch base about, I developed this new thing, and I'm not sure if it's a side effect or an adverse effect or, things like that. And it's also part of that. You should have a goal to face-to-face with somebody every 30 days and step out of your isolation. What do you think is on the horizon for pharmacy as insurances are changing? As there are a lot of people that feel they're going to be facing no insurance coverage, or mail order coverage where you don't ever see your pharmacist. Your hair could be falling out. You could have lost an eye. They won't know. Mm-hmm. They're never going to see you. What do you think are some of the things that those fears? How can we start to preemptively battle those things?
Yeah, there's a lot of potential sky is falling things, especially with pharmacy, and a lot of it is the pharmacists have done it to themselves by making themselves a commodity rather than a service. You can go and get the cheapest drugs here, and it doesn't matter what kind of service you get because you can get the cheapest drugs. Well, they need to change that around and get back into more of the service, which one of the greatest shames of pharmacy right now is that we're not even medical providers. It's like the chiropractors and dietitians and pretty much any other profession you could think of is a medical provider, and pharmacy doesn't count. And what does that mean? It means that we don't get paid for any service from any insurance company. And one of the kind of the things on the horizon, hopefully, that pharmacy is always talking about is becoming medical providers and then being able to perform some sort of a service. So, and pain would be one of those perfect ones where, say you go into a pharmacy, and if you have a chronic pain problem, you go into a pharmacy and you sit down for half an hour and talk to the pharmacist every single month about what's happening, where are you at, what are the side effects you're having, does anything need to be adjusted? And then, at least from the pharmacy side of things, then they would get paid by the insurance or whatever for having this.
For that time.
Yep, for that time. And then you'd have a kind of set up a practice with a doctor who kind of oversees you. So then you say, hey, I saw this person. I think they're doing great. We're going to keep on it. You're going to okay the same prescription for this month. And then, hey, they're having really bad constipation. I think we should add this to the mix. And that would be just wonderful. I mean, pain would be one of the things. Otherwise, blood pressure or cholesterol, whatever. But in this scenario, pain is the perfect kind of diagnosis to do that, because it's a very hands-on. How are you doing from a month-to-month basis, and might need a lot of adjustment. Whereas blood pressure, you might not need much adjustment at all. So. Right.
But yeah, there's a lot of. With pain, there's a lot of the weather affects you, and the holidays, and stress, and all those things that can affect other conditions, your diet, your activity level, things like that. I kind of asked prior to recording if you were comfortable, if there was anything that was a no-go topic, and one of the things that you said it was okay to talk about. We are again recording in South Dakota, but what about alternative medical therapies? How do you feel about patients who are taking non-prescription items in addition to their prescription items? What is a good way for them to... You as a pharmacist need to know if I'm taking herbal supplements, if I'm taking anything I'm ingesting in my body to treat my pain. Mm-hmm. And what's a good way for people to... Especially with chronic pain, there's a lot of shame and a lot of hiding. Even if you're not doing anything wrong, even if you're just like, all right, every single day I drink 16 ounces of green tea. That's something that actually a pharmacist might want to point out and say, well, did you know that that's thinning your blood? Or did you know that that's maybe contributing to your headaches because that's caffeine? Whatever it is. How do you think people can overcome the shame and be honest about what they're additionally ingesting?
Sure. Well, first we'll back up one little tick and just say with having your pharmacist know everything you're on, probably the more common scenario now is going to be insurance companies forcing people to do mail order except for pain medicine. So you could be getting lots of stuff through mail order, but then have to get your pain meds or other kind of more immediate meds through a local pharmacy, and then they're going to have zero idea what you're taking elsewhere. So if you don't bring it up to them, I mean, they might ask, but for the most part, they're not going to know what you're taking. So if that's a scenario, then you should let them know all the other stuff you're getting through mail order too.
Because as a pharmacist, you're only as good as the information you're given. If I don't tell you I have a drug allergy, if I don't tell you I get medication from multiple pharmacies, and not just in that drug seeker way, but like you said, maybe I'm getting my blood pressure medication from mail order, and I'm coming to you for my Adderall.
Yep. Exactly.
And your system can't check for those interactions, and you can't check for those interactions because you don't have that knowledge.
Mm-hmm. Yep, exactly. So that's just one of the things too. If that's a scenario that you're in, you might want to just bring that up to your pharmacist, especially anytime there's something new. So just maybe show them, hey, I'm on these things too, any problem that you see. But for other things, I think probably you're specifically mentioning like maybe marijuana,
which I think there is that, but also even just the wide variety of supplements and things out there. I think people are sometimes embarrassed of what they'll try, or there's the shame factor. And I do think, yes, there are people that, like if you're in South Dakota and you're using marijuana medicinally, you are working outside of the law.
Yeah. that is one of the most unfortunate
gray areas.
Yes. I know the Board of Pharmacy in South Dakota kind of testified against medical cannabis, and I'm like, we should be on the opposite end of this. We should be championing this. We should be saying, hey, we want it to be an option, and we want to be at the forefront of this, because there would be no better way of helping people kind of incorporate that into their medications than a pharmacist, and saying, okay, well, if you're going to start taking medical cannabis, then how about you maybe start it just at night, and then don't take your pain pills at night, and don't take your muscle relaxant, or don't take your sleeping pill. Let's see if we can replace that with this, and that sort of thing. And having a pharmacist really say, because you're doing this new medication, you don't need to take all these other pain meds, and have like a goal in mind of, we want you cut back by 50% of the pain meds you're taking by introducing this.
I think with supplements and marijuana, and even just layering on medications, I think you hit on a really good point there. A lot of times, especially when people aren't being upfront about everything they're taking, they are not replacing a dose of something else. They're taking it in addition to.
Exactly.
When ideally it should be taken instead of some doses, or not everything is an adjunct. Some things are a replacement. Yeah,
but then there's other things where, like, say a chemo medicine or something, keep taking your full dose of that. But if you want to try another herbal thing on top of it, depending on what it is,
right.
You don't try to replace that. But there's kind of, you don't know. You have to replace some, and you have to add on.
They're honest with their practitioner.
Yep, and that's hard. You just have to find a pharmacist. I don't know, maybe quiz them. But find one that you trust. I'll tell you right now, no pharmacist is going to call the police on you if you said that they shouldn't. That if you said that you were trying to, treat your pain.
As long as you're not walking in and being like, so I've got a bale of ganja in my trunk.
Yes.
And it's in your parking lot right now. Mm-hmm. And do you think that maybe that is an element of the smaller pharmacy setting? You're less likely to be surrounded by a crowd of other onlookers.
Yep.
Maybe less of a judgmental environment. Maybe more able to build that personal relationship where you can be honest about what you have or want to try or are doing. Mm-hmm. Because you can develop that relationship where they know who you are.
Exactly. Yeah. No, I've at least kind of locally, I've been on a couple of things on PBS or whatever about medical cannabis, and as soon as people saw me on there, I had a lot of my patients ask me, do you think that would help me, and what do you think, how do we get this going, how do I incorporate this? And I was like, well, we can't now. If you want to take a weekend to Colorado and test it out, just don't take these drugs while you're doing it, but at least you'll know if it works for you or not.
I think that right there are places that are reasonably accessible for people locally to even drive to or go visit, and they will be motivated to try those things. And so if somebody is, even just like I think about snowbirds that go to Mexico for the winter and buy all their meds in Mexico for the year,
yep.
There's nothing wrong with being on it. You're not doing anything illegal if you go to Colorado and smoke a joint.
Yep.
You are within the laws of that state, and more power to Colorado, and way to go. So they should maybe say to their pharmacist, hey, if I go there and I have the opportunity, I think I might try this.
Yeah, what should I
watch for?
Any meds I shouldn't take while I'm doing that? Or that's a great point. Yeah, absolutely. So
yeah, even just, again, it's nothing, if you're not doing anything illegal, where you're going to, because we're going to assume that no one's up to anything illegal. If you're going to go somewhere to try this, there's nothing to be ashamed of in being honest about it. And I think that's one of the things that people forget, sometimes even more than doctors, because pharmacists see you so often, and they see your whole family. My doctor just sees me when I go in for appointments, but you see, if I come in and I bring my grandma along and my kids, and you have to sit next to patients or customers at the baseball game or whatever, you see them in their real life setting.
Yes.
You see me when I'm just there shopping for diapers and makeup and whatever, and if I'm, you're going to see me on a real life basis. And I think that is more impactful if I sit down and say, all right, my doc has put me on this drug and I'm fucked up all day now. Mm-hmm. Where if I go in and I only have 20 minutes with my doctor once every 90 days, I don't have time to tell them what I'm fucked up about sometimes.
Yep. Yeah, pharmacists are one of the most underutilized, best resources that are in medicine. They're the most easily accessible healthcare professional. I mean, you make a phone call and you can have them on the phone. You can't just call a doctor and say, "Oh, let me talk to the doctor." It's usually several different phone calls and messages and things. Even a chiropractor goes through, a nurse or at least a receptionist.
Right.
You don't get a pharmacist. You can get on the phone immediately, or you can walk in and see one immediately. And it's just unfortunate how underutilized we are as a profession,
and under reimbursed for it.
True. Yep.
Like when I'm paying so much for my health insurance and prescription coverage, it's in a way I'm getting cheated by my insurer because they're paying for me to have the pills, but they're not paying for me to get the education about them. Mm-hmm. And that's one of the interesting things about pharmacists is you're going to give the education even if you're not getting paid to.
Yeah, I just had one yesterday that I showed the student where it was a new blood pressure medicine that a person hadn't been on, and the total reimbursement was 40 cents. And I said, okay, so for this 40 cents, we're going to give them the drug, the bottle, the credit card charge,
right.
And we're going to sit down and tell them how this affects their body and keeps them alive. And then if we were to do something wrong or if something were to happen, we might get sued for it. But that's for all that.
But God love us.
It's 40 cents.
Here's your 40 cents. Mm-hmm. And we just have to hope that they don't pay us with a Canadian quarter.
Yep.
Because then we made even less.
Mm-hmm. I only accept Bitcoin.
You only accept Bitcoin? When small town pharmacists say Apple Pay, they mean an actual bushel of apples.
That's funny.
Somebody
asked me that the other day. Do you accept Apple Pay? It's like, I don't think so.
You got to be like, well, is it Granny Smith?
Yeah.
Or the Delicious? What, can I make a pie with it? What do you think, like you said, you have dealt with in your personal life family members that have chronic pain. And you were pretty open with, in your years in pharmacy from before that happened and now that it's part of your life, that it's changed your perspective about pain patients. Mm-hmm. How would you describe your perspective before?
Well, it really was a lot of, if they come in and, if you heard the word fibromyalgia, which...
And he knows I have it, and full disclosure, Tom and I have known each other the duration of your pharmacy career.
Yeah,
I
you
knew
were there
you as
before.
A student.
Yep, you were there before I was.
So Tom has... What year did you graduate?
2006, but I worked there for 5 years beforehand.
So when Tom and I met, I had already been sick for several years. The first decade. I was already 10 years into having fibromyalgia. I had already been diagnosed. So when you talk about fibromyalgia then, in the beginning of your career.
Yep. Yeah, that was just that buzzword, meaning, somebody who's looking for pain meds. Mm-hmm. Because they don't have to prove that there's any pain. They can just get whatever they want by saying it's fibromyalgia. It's like I started getting really jaded as a pharmacist with the number. You only remember the bad people. So even though there's probably for every one bad, there's 10 normal.
Right.
But you remember the bad ones. So then you start thinking that everybody who has fibromyalgia is a seeker. And after a while, I was like, I don't want my pharmacy career to be like this. I need to go into some other avenue. So now and
like you said, you probably had, for every one patient that said, well, I have to have it, I have fibromyalgia, I'm in so much pain, you might have had 10 other patients that never even told you that was their diagnosis, and they just had a better management plan. And they weren't apparent to you that that's what they were dealing with.
Exactly. Yeah, it's really, and I know there's still a lot of pharmacists that have that same sort of, jadedness where people looking for pain meds, they just kind of get it in their minds that if they're looking for pain meds, they're all addicted, or they're all trying to abuse the system, or they're all selling it on the street. They just you start feeling that way. But that's just unfortunate that happens. But it's not it's not everybody, and I think it kind of depends on the day. But
I think absolutely, and I think even as a patient, I try and be aware of my own behavior. Which again, I have tried to get past the idea of being ashamed that I have a pain condition. I don't have any shame for it or taking care of myself. But I do try to be aware of how I present myself as a pain patient. So now that you've experienced watching someone go through chronic pain and kind of come to terms with living with it, how do you feel now? When do you feel more? There's a big difference between feeling sympathetic. I don't like people feeling sorry for me, but empathetic, feeling like they understand, is different. Do you ever feel sorry for people because you realized that up until they dealt with you, they probably were dealing with people that thought they were crazy?
Yeah, no, I completely get that. I mean, that's I have a lot of customers who I think they feel that I've treated them differently than what they've had in the past, and they really appreciate it. So I'm glad that I'm not glad that I had that perspective forced upon me, but I'm glad that I have that new perspective now and know kind of a better way of helping my customers out.
How do you teach students to not be jaded?
One of the assignments my students always have is they have to interview somebody and look at their med list and then come up with ideas on how to help them. And I usually always have them use my wife so that they can hear her story of her...
her life experience.
Yes.
Her health experience.
And
then, because behind closed doors, then she can be honest with you if they were stupid.
Yeah.
And like maybe they were book smart, but not horse smart, street smart.
Get a lot of those. It is quite amazing of the whole different rainbow of students that are still coming through. Which ones should end up in the basement somewhere, and who should actually be out there talking to people. But yeah, I'm trying to teach the new class what that don't be as scared about pain or people with pain as you might be seeing right now. I mean, it's be more empathetic. Understand that this is a real thing that people have, and they need help. They're looking for your help. They're begging for your help. So just be ready for it,
and be willing to be, as we said, part of that management team and management plan. How do you advocate for the patients when it comes to what if you see a patient that's filling too often, or you've talked to them and you know that they're not taking their medications correctly, whether or not it's because it's not working, or maybe they are starting to slip into where they're not only are they not getting pain management, but their body is starting to experience addiction effects. How do you advocate for them, as you're going to see it before their doctor does?
Yep. Well, if I see them starting to fill a little too often for my liking, so now I think in every state there's something called the Prescription Drug Monitoring Program, which is for any controlled substance, gets automatically reported to the state, and then if you're concerned, the pharmacist can look it up and see if you're filling things at other pharmacies with other doctors, and you're just to kind of make sure that people aren't buying, not running insurance or going buying cash elsewhere.
You can look for a pattern of behavior.
Yes. So, but then that's also kind of a good tool for making sure people know that you're being watched. So you kind of need to. I usually go in and tell them, okay, I realize you filled this early the last 3 months in a row, And I just want to, we have to, you might have a few extra pills in stock, and I understand why, but we need to get this now on a monthly schedule. You can't do this anymore every single month. And then I usually make a note, and then if they come in and say they're going on vacation and they need it 5 days early, then I'll say, that's fine, we'll do it 5 days early. Next month, we're going to do it 5 days late, because you already have a stockpile, and we have to get back onto the 30-day pattern. So, I just try to make sure, I'm honest with them. I can see that you're filling early, and I can show you that you're filling early, and you understand, and we both understand why you're doing it, but let's just get onto a good schedule now, and not so neither one of us have to worry.
I think it's hard too, because there is no there are so few diagnostics for pain, whether it's in the clinical setting or even in your home. I mean, you can take your blood pressure on a blood pressure monitor at home every day. You can check your blood glucose on a machine every day. I can't tell you today how much pain I'm going to be in. I can't determine what's going to come at me that's going to alter it, and I have no way of quantifying my pain level to you. If somebody comes in and says, I feel like my blood pressure medication isn't cutting it because my blood pressure is still up every day, they don't often start then choosing to take their blood pressure medication 3 or 4 times a day and hope that it works.
Exactly,
they will come in and say, I don't think it's working. What do I need to do?
Yeah.
Whereas with pain, sometimes we don't know. Is it just a worse day today, or is it not working? Mm-hmm. And so we do a lot of self-regulating and testing we're our own guinea pigs. Mm-hmm. How do you think patients where chronic pain is their primary illness can benefit from a closer relationship with their pharmacist? Do you recommend things like, I haven't really talked about it on the podcast before, but like specialty packaging and things like you said, visiting monthly, and this is your pickup day, and we're going to go over your count of what you have. How do you think they can overcome that? I think that they have a fear of being limited.
Yeah, exactly. A fear of being limited is a good way of putting it. To just wake up one morning and not have anything, not have the medications, not having any support or anything would be a horrible thing. So I can see how that fear is something that's always in the back of the mind. But yeah, there are the special types of packaging out there to that's kind of like the 7-day pill packs, but except for that people will put them together for you. There are several places that'll do that, at least in this area, for no charge. But one of the things that we haven't really discussed that I just kind of recently had is had a patient who got a genetic test done, and they came in and showed me their results for the genetic test, and it was unbelievable that is not required for every person who's on any medication. It is. I looked at that and just thought,
how much time it would save to already have these things wiped out. Don't even waste your time with.
For everything, for statin drugs and for cholesterol, or obviously cholesterol, but for like antidepressants especially, but those are all just guess. You just throw them on something, and then you guess, and then you try something different. Well, this person's had like 10 in the bad column, and the only thing that they were really supposed to take was citalopram. Well, that might have been the 5th one on the list before we got to that. And I don't know how much genetic testing costs, but it seems like it should be a requirement for anybody. As soon as if they're prescribed any drug, they should automatically have it happen on their 18th birthday. Congratulations, here you go.
Here's your genetic testing.
Yep.
I think that definitely, and we've had an episode where we talked with a patient went through that in the hopes of clearing up some of their chronic pain issues. And yeah, hindsight is 20/20. They looked at, for years we did this, and how much time and money was wasted on those doctor visits and those medications, and whatever that testing would have cost probably would have saved them a lot of dollars over time and heartache. Mm-hmm. What do you think? as we're kind of coming to wrapping up our time here, what do you think is the key piece of advice a pharmacist would give a chronic pain patient?
Well, I guess the best thing I can say is find yourself a good pharmacist that you can have a good relationship with. I mean, that's the main thing. If ask them some questions, tell them your story, see what they think about your situation. Tell them you have fibromyalgia and see if they roll their eyes or if they're like, oh, I have a friend who has that and I understand that. I mean, if you could probably figure out what a person thinks about that pretty quickly. But
another advantage to community pharmacists, it is face-to-face. It's not over. I mean, I can walk in and watch how you react to me.
Oh, yeah, absolutely. But, I mean, there's depending on your insurance allowing it, but there's a lot of choices in most areas of different pharmacies and pharmacists. And it's just like a job interview. Go and you don't need to pick the first one that you come across. Go find the one you like. I mean, because it's not about a chain. It's not about like Walgreens or Walmart or anything like that. It's about the individual pharmacist. Like if I worked at Walgreens, I would still be the right pharmacist to go and talk to because of my personal beliefs.
Convictions, right.
But you have the worst pharmacist at one of those big chains come to work at my store. You wouldn't want to come there either. So it doesn't matter. I can't say go to this particular place. But find a good pharmacist. But usually it's going to be in a kind of a less busy place, so further have time. But go interview a few and figure out which one you like the best.
And with that in mind, once they find one that they like the best, I think from a patient perspective and from both sides of the counter per se, don't be ashamed and try to be honest.
Absolutely.
Don't be afraid of what you're about to tell this person.
Yep. Do not lie. Do not ever tell a pharmacist that you flushed your pills or accidentally dropped your pills in the toilet.
And no one believes your grandma's cat has diabetes. Mm-hmm. They just don't. They just don't believe it. Bring me, as like in Ferris Bueller, bring me your dead grandma. No, don't tell a story that's been told 1,000 times. Mm-hmm. At least be more creative. At least spice up your pharmacist's day.
Yeah, really.
With your honesty.
Mm-hmm. Oh my goodness, you're honest. All right.
We can be friends now.
I don't know what to do with that.
You'll have to come back tomorrow once I've pulled my composure together. Well, I thank you for sitting down and talking with me. Just kind of because people don't get to do that. People don't get to sit down and just talk with professionals of all kinds about the stupid questions. How do I get you to believe me? Which is a big thing in chronic pain. Please believe me. Please believe me. And it'll be interesting. Maybe when we're not recording, I'll ask Tom, when did he start to believe me that I wasn't crazy? Because I don't think it's happened yet. But we'll see. But I do thank you. And again, tell us the name of your pharmacy.
Brandon Pharmacy.
Brandon Pharmacy. So creative. Mm-hmm. So Dr. Tom Wullstein PharmD. I should explain to people, what is a PharmD?
A doctor of pharmacy. So a little bit more training than they used to be just registered pharmacists, and now it's everybody that's graduating is a doctor of pharmacy. So.
And pharmacists are now, I know here in South Dakota, it's happening more and more. There's a lot more clinical things that you're allowed to do, vaccinations. Mm-hmm.
Depending on where you work, like at the VA, they're very progressive about letting pharmacists do a lot of the warfarin testing and things like that, and kind of changing people's drugs around. So we're hoping that's kind of the future of pharmacy, because if the future of pharmacy is just insurance reimbursement on drugs, it's not going to turn out well for us. So.
Right. And one thing that we didn't really touch on, but for anybody, can you just give a brief overview of what an MTM is?
Yeah, medication therapy management. It's basically you do a comprehensive look at all the medicine you're on, kind of just sit down, look at everything, find out, there's always going to be drug interactions, so you figure out these can make you tired, are you having that, or maybe you should take these at different times of the day, just maximizing the therapy you're on and figuring out what's best for you. So it's good to have that done, especially if you're on multiple medications.
And that's for people of any age and any health condition
Absolutely.
to come in and ask their pharmacist about MTM. And there are some patients, especially over certain ages with certain insurance plans, that is something that sometimes your insurance plan will pay for the cost of a full-scale MTM visit with your pharmacist, where you do make an appointment and you do bring in everything. And I think that would definitely be a good place for a lot of people to start once you've interviewed those pharmacists and picked the one you like. Is say, all right, let's sit down and go through what I've got here and figure it out. So definitely all good things to go in and ask about. And if you are looking for a pharmacy or a pharmacist to start with, Tom Wullstein, Dr. Tom, Sushi Farmer, find him on Twitter. You have to be a Vikings fan, or maybe you don't have to be, but say that you are. Stop out to his pharmacy, and that might be a good place to start. He might be a good first interview for you. So thank you, Tom. Have a good day.
Thank you very much.
Thank you for listening. Tactical Pain is hosted by Jeni Mc, produced by Robert Mailing, and is part of the Sioux Empire Podcast Network. Visit us online at pain605.com.